Well, Mayo Clinic will soon have its own mandatory vaccination program.
This comes after President Biden's vaccine requirement for all staff within Medicare and Medicaid certified facilities. Our Carly Petras joins us live outside Mayo Clinic with more on the possibility of termination for healthcare workers refusing COVID-19 vaccine. Carly, what have you learned?
Well, Zach and Caitlin, Mayo Clinic has not said their plan for this vaccine proposal yet, or whether or not they're going to terminate those who refuse the proposal. But healthcare systems in Minnesota, like Minnesota Children's and Allina Health, have already put in deadlines for their vaccine mandates. Mayo Clinic is the largest employer in Rochester, with over 30,000 employees. In a statement it sent us, Mayo Clinic says, vaccination is the best tool for preventing serious illness and hospitalization. Mayo says it is implementing a new mandatory vaccination program in the coming weeks. According to a business and employment attorney, vaccine mandates are completely legal.
Employers can do anything that can require anything that's not illegal. So they can't discriminate against people in protected classes such as race, religion, national origin. But they can require pretty much anything else.
Attorney James Godwin went on to say vaccination status is not a protected class, meaning employers are allowed to fire those that do not comply with their vaccination policy. There are most likely only two ways to get out of an employer's vaccine mandate right now.
I have a medical exemption, which there are no conditions known right now that would prevent someone from absolutely not getting a vaccination. Someone may have something specific that their doctor could speak to, but they're pretty rare. And religious exemptions are going to be difficult to get because the belief has to be sincerely held.
The coworkers that are choosing right now not to, it is because they don't feel that they should be mandated or be told what to do with their bodies. And some are willing to lose their job over it.
The Minnesota Nurses Association sent us a statement saying it believes that voluntary vaccination programs, along with other essential infection control measures, are the most effective strategy for a healthy population, and that all those who can be vaccinated should be. The association also says we question the timing of the impending vaccination mandates and believe these mandates will continue to exacerbate staffing shortages.
We're not going to be able to fight a mandate like this. This is a countrywide thing. And because we are in the pandemic, this is what it is. So if you leave this hospital and you decide you want to go work at another hospital, likely they're going to require that you have this vaccine in order to work there.
Attorney James Godwin told me that when he has spoken to those that are concerned about their employers instilling a vaccine mandate, he tells them to do what they normally do when they have a medical question, and that is to see their medical provider. Live in Rochester, I'm Carly Petras, KTTC News.
Okay, Carly, thank you.